Waiting for her, waiting for her.
Hey!
Good morning, Atlantic City!
What's up?
What's going on?
You know, treated a couple patients already Monday morning.
Wait, you're at the clinic?
I'm at the clinic. We're open until further notice. We're still treating patients, seeing a lot of emergency cases right now. Everyone's moving a lot and cleaning up and getting back into exercise.
Yeah.
So it's actually great. It's interesting. It's cool to see all these injuries right now.
That's awesome. Yeah, I didn't think you guys were going to be open this morning.
Yeah, so we actually, all of our hours are the same, except we close at 6 now instead of like 6:30 or 7, depending on which night it is. And yeah.
Okay, awesome. So this is episode 2 of Talk the Walk. Thank you for
this. Is really cool.
Yeah. I met Dr. Karishma Patel in Chiro School. We were in the same class. She used to always take the test like right before me because she sat right before me alphabetically. And sometimes she took the test for me because K Patel, what's K Patel? It's the same thing, right? Actually,
Karma always had the highest scores in all of our classes, so
not true.
His score was my score.
That's what you showed your parents. You're like, look, K Patel, K Patel. I'm in the top three. Okay. So right now you're practicing. You moved home to Atlantic City after you graduated. You worked at a clinic down there, and then you decided to open up with them in your hometown.
Yeah. So, okay. My story pretty much goes, graduated from Chiro School, and I was like, no, I'm not going home. And I ended up going back home. One, I couldn't sustain myself elsewhere with no money and, being in debt. And I was just like, you know what? I'm going home for a year. And I'll build money up, and we'll take it from there, and we'll try to figure out which city to move from there. And here we are, 5 years later, still here, which actually was probably the best decision of my life. So life kind of just takes you where you need to be, and I think exactly where I need to be. So I actually started practice with a CrossFit. It was basically a CrossFit gym and a clinic, which was super cool because I was like, well, I kind of know what you're doing, but I don't. And so I had to start taking CrossFit classes, and I had to figure out what the hell is a snatch? Like, how do you deadlift properly? And it was like really cool because I was starting to practice, and I'm trying to apply everything I know and then learning all these movements. So that was like the best part about starting right away in a movement-based clinic, gym, whatever.
Right.
And then I moved on to another opportunity at Thompson Healthcare. That's where I'm at now, and I see a lot of different types of patients here. So I'm not sure if you want me to get into the background, Karma.
Yeah, go for it. Do it for our viewers.
Cool. So basically, I'm a chiropractic functional neurologist. What is that, right? Like, let's not move past words we don't know.
Right.
Basically, I look at your function, how you're moving, what your brain is telling your body to do, and then we fix those movement patterns. And I feel like, you don't have to be a chiropractic functional neurologist to do that. I feel like we all do that in some sort of realm. And that's really exciting. So
you actually have like a specific degree for it or certification for it.
Right. Yeah. So I spent 3 years during school and after school, just going to, I was literally in a classroom every weekend, every single weekend.
Yeah, I remember you and Deepa used to take a lot of those classes on like a monthly basis? Or was it every weekend?
It was like a monthly basis, but then I would take other classes along with the neurology diplomate that I did. So it ended up being like 2 or 3 weekends every month that I was away.
Yeah, it was a lot, but like you guys sacrificed those weekends because everyone was like, why are you doing this? And then you took the exams. There was exams associated with it as well. And now you're fully certified. Yeah. What led you to doing that as opposed to, let's say, another degree? Like I did the sports physician one. Like what led you to doing neurology? What drove you towards that?
So our last year in school was, you know, I think each of our friends in our friend group had like an honors internship somewhere, which was sick because we would all just call each other and tell each other our experiences. So I ended up being at the South Shore Neurologic Clinic in Long Island, and my mentor there just crushes it, man. He's just eloquent but very casual, and I just wanted to kind of emanate that within myself and practice what he preached. And so I think that was a huge thing for me, and what really kind of led me to do the neurotip.
So he already had that degree and he was applying that?
Yeah. So that was really cool.
Okay. Do people specifically come in because they're like, hey, I want to see a chiropractic neurologist, or it's, I guess, peace of mind once they do come in that they realize you are additionally certified?
Honestly, it's more word of mouth. And I get so many referrals because of that certification, but most people don't know what the certification is when they walk in, right? Like, they're not exactly sure. I've only had like 2 or 3 TBI patients, like with strokes and TBIs, that have actually looked up my certification to see exactly what I do. And then most of the time it's like, oh, you should go see Dr. K because she does X, Y, and Z kind of thing, you know?
Well, it's word of mouth because you're doing a good job. That's the only reason why people would continue, right?
Right, yeah.
If they see that success rate is high up there. Okay, let's backtrack a little bit. Were you playing sports growing up? Like, how are you being active, or how are you incorporating movement? Or is that something you kind of developed or started to grow an appreciation for throughout chiro school?
So actually, I did a lot of different sports growing up. I did gymnastics, so I have a low back injury from gymnastics. By no means was I any good. Like I was okay. I was by no means like a star or anything. So that was, but that was my first real like sport, and especially soccer. My high school didn't have a soccer team, so then I had to transition to playing volleyball and softball. I have never played either of those sports ever in my life, but it was so cool because by the end of my senior year, I was captain, and it was cool to go from not knowing a sport, not knowing the movement, to actually being able to learn it and apply it and then lead a team. That was cool.
That's awesome.
Yeah.
And then in chiro school, you played on the rep teams?
Yeah, kind of. Chiro school, I was just deconditioned. Like, I thought I was fit, but I really wasn't.
Well, you're taking all of, like, the fit people who like did kinesiology or played sports, and they understand and appreciate chiropractic, and then you're putting them into school. Like, what's going to happen? You know, you have like the best of the best. There's like, I know Joe played like varsity volleyball. What's his name? Will played D1 basketball. Like, it's just crazy. Like, you take all these athletes and they already understand and appreciate their bodies, and you put them in one school, they're just going to compete. Like, it is what it is. Like, how's things were like crazy.
No, yeah, I completely agree. And then, you know, you're sitting in a classroom for 10 hours and you're sitting. That's it. Yeah. So I think chiro school was probably the least fit I've ever been in my life.
Damn. Okay.
Yeah. So it wasn't until after chiro school where I was just like, definitely put in the time to learn, to reach out for other resources to figure out what movement is, you know, like what is.
Okay. So what is movement to you now? What's your now understanding of movement and how it applies to someone's life? Like in terms of what types of training, how much they should be moving, what they should be investing their time into.
Yeah, so this is like, I think every person that comes into our clinic asks this question. And last week we got the question of, hey, what sport should I play? And it was just very vague. So the way I look at it is now what I've put in, the training I've put in the past 5 years has led me to be a better clinician, a better practitioner, a better educator to the providers and the doctors that I actually train now, as well as for my patients. So I see movement as, if you can't do something, well, what is it going to take you to get to that movement? What can we train individually, not just individual muscles. We don't really train individual muscles. We train in anatomy trains, if that makes sense, you know, like functional slings.
Yep.
And now
what's a functional sling?
What's a functional sling?
Ask for a viewer.
All right. So functional slings are what connect muscle groups together. And that's exactly how you can do the movement. If you don't have a muscle sling, so if you think about it, your pec and your hip, so shoulder to opposite hip is a sling. It allows you to rotate. It allows you to do a lot of those rotational sports like baseball, golf, and whatever, right?
Racket sports.
Racket sports, exactly. So basically, that's a functional sling. Which functional slings work together?
Right.
So now I don't look at patients like, oh, you got a glute medius issue. No, it's a functional thing. We have to figure out what's not working, what's working too much, and try to integrate the system.
Yeah, that makes sense. So in terms of a functional sling, if you're applying that to a patient who's an athlete, if you're not directly targeting, let's say, the glute med, what would be your overall, I guess, treatment plan or therapy for someone whose sling is broken?
Yeah, so we pretty much look at their movement. We have a functional movement assessment, and then we say, okay, well, these are the things that are inadequate, and these are the things that are adequate. So we kind of start with what the patient has, because they're comfortable. They have muscle memory. They can use that part of the body properly. So
right.
Then we take that and we say, you see how comfortable this is, and there's no dysfunction? Well, we want this part of your body to do the same thing. And now we have to train it to get it there. So honestly, it's a case-by-case basis, of course. So we pretty much take movement, and sometimes it's just body weight movement, moving in general, because you haven't right. moved in that sling or that rotation, or you don't even know what, rotation or that kind of movement is. So it's basically telling the brain, hey, listen, we have this movement here. Let's use it,
Right, right. So it's firing up pathways that haven't been fired in a while. And then the brain, the way that neurology works is that the more you fire it, the better you become at it. Perfect practice makes perfect, right?
Nerves that fire together wire together. And just because you have neck pain doesn't mean you don't have a low back issue or a diaphragm issue, or, your neck pain could be caused by something other than your neck. So that is one thing that I think professionally, personally, that I really try to teach my friends or teach whenever I'm teaching or training. It's not just where your pain is, but why is it doing that? Why is that part of the body showing pain, and where is the dysfunction coming from?
Right. Makes sense. Yeah. Deepa, your colleague from Neuro is responding there. Okay. All right. So what is your ideal, let's say, movement, or like, how do you approach someone and say, this is how much you should be moving? How do you encourage movement?
Man, getting people to move is like, you can lead water to a horse, but will the horse actually drink the water? It's a huge challenge. So I'll tell you what those obstacles are. It's usually time. I don't have time. I'm too busy. I don't have the money. I feel like I need a huge gym membership to move, Yeah. I have an injury, so now they're taking their condition and making it their own. Like they're saying, oh, well, I have asthma, so I can't exercise. And that's like mind. So now you have to change their mindset to be able for them to move. And, that's okay, because if you have had an emotional, traumatic injury and now you're holding on to that trauma, that apprehension, you're not going to want to move. Your brain's going to be like, no, we're not going back there again. So now we want to retrain that mindset so that the brain's more comfortable going into that movement, right? So yeah, those are the most biggest obstacles. And how do we get through those obstacles?
Like, how do you convince someone that, like, you know, if they think, oh, my knee's injured or my back's injured, I'm never gonna be able to deadlift or do weight training. Like, how do you break that pattern? Like,
So
do you add a little bit of weight and then slowly build on it, or?
So I always start with mindset first, because if your mindset's not there, I can say whatever and you're not gonna listen to it. So I have these awareness questions that I literally say, okay, well, is it getting better or is it getting worse? And most of the time it's getting worse. The problem's getting worse. Well, if the problem's getting worse, what are you doing about it? Oh, you're not doing anything about it? Okay, so these are your options. Let's get it better. And then my number one question is, how committed are you to treatment? How committed are you to movement? And if you're anything below a 9 out of 10, 10 out of 10 being the most commitment, I'm going to say, hey, listen, you're either going to have to find another practitioner, or I can't treat. I'm not able to give you my time if you're not able to put in that 9 out of 10 or 10 out of 10 commitment. So that's my, like, okay, I'm in the mindset, I'm here to help you. If you're willing to take the information, we'll go forward. And then we're like, okay, what can you do? So let's start with that. And then usually my frequency is, you have to do something 2 or 3 times a day for your brain to be like, okay, I get it.
Make it a habit.
Yeah, repetition. So start where they're comfortable and then lead up to, you know, what we want their body to do. Right.
That makes sense. And then what's your ideal movement? I know we discussed this a few days ago and then I had to cut you off because I was like, let's just save it for this interview. So what's your ideal movement? Like, what do you think makes up like a good like movement routine?
That's such a broad question. That's a really good question too.
So let's say I want to start moving. Should I go fully into strength training? Should I?
No.
What other pieces do I need?
Okay, so you need to. So when you paint a wall, you have to actually prime it, right? So same thing with your body. You kind of have to prime your body for movement. You can't just jump into a strength training program without actually learning the basics.
Right.
So pull, push. You have to know how to pull and have to know how to push upper body and lower body. So just start with that. Start with body weight. And then you can add in the rotation, because rotation's a little bit more complex. Flexion, extension. So you always have to think,
the 6 planes.
Exactly. Yeah. The planes, and how are you going to prime your body for movement? So everything has to start with basics, right? And then the other biggest movement dysfunction I see in 99.9% of our patients is breathing. If you're not breathing properly.
Yeah, a lot of people will hold their breath at like the bottom of a squat, or they'll gas out. They'll try 10 push-ups just holding their breath. But then if you ask them to do any more, they'll quickly exhale. They'll turn red. Their face will flush. Yeah.
Exactly. So we work like at least the first 3 visits. And even with me, I work on a lot of breathing. When I'm watching a show, I'm not sitting on the couch initially for the first like 10, 15 minutes. I'm on the floor. I'm, putting my knees up, getting my diaphragmatic breath going. And I usually do it before I even roll out of bed and while I'm going to sleep. So it's more of a repetition.
Right. How often, how many cycles do you think you end up hitting in like a day, let's say, of breathing?
Of breathing.
Like not just regular breathing, like this, like, I guess purposeful or intentional breathing that you're like, I'm going to do this now. Like, how many cycles do you think you end up doing?
So probably 3.
Okay.
So before I roll out of bed, it's always 8. So 8 in, 8 out. So 8 inhalation, 8 seconds of inhalation, 8 seconds of exhalation. And I do that for an 8 count. Before I go to bed, I usually am passed out before I even hit 8. So I usually get to like 5 or 6. That's my body's way of like calming down.
Yeah. Because it's kind of turning off the sympathetic nervous system, firing up the parasympathetic.
Exactly.
That's in that area, and then the diaphragm's rubbing up against the autonomic nervous system. That makes sense. So I went to a seminar. It's for the National Strength and Conditioning Association, and they had one in Toronto. And they had this lady come in who talked about diaphragmatic breathing. Her thing was to exhale for 7 seconds, inhale for 5, and then you hold. You paused for only 3 seconds. So it was like a 15-second, I guess, cycle, and that's kind of what I approach. That's my approach. And I usually do 6 cycles with a patient or so before we kind of move on, just to kind of see how they're feeling. I do have one patient or a few patients who can't separate their diaphragm from their psoas. So they need it. That's how they engage their core, actually, is to just stiffen up the diaphragm, and that's how they turn on their core. So I'm trying to dissociate the two so that they're involved separately and they fire separately. They can function separately.
So that's a really good point, and this might be a little bit too advanced, but I want to bring it up anyway because it's a huge point. So there's an arcuate ligament that attaches the psoas into the diaphragm. The reason why people have disc herniations, low back issues, neck issues is because when their diaphragm isn't expanding and contracting, well, you're taking away that movement from the psoas, and the psoas either destabilizes or tightens up even more. So when you can't breathe, you have other joint issues. People come in like, okay, I have a knee problem. Why are you making me breathe? Why are we making you breathe? You know?
Yeah.
Proximal stability equals distal mobility.
I like that. Never heard of that. I will write that down. Yeah, I always have these like elaborate talks with patients, like educating them. But usually I say like your strength will come from your core and your pelvis and then move outwards. If it's not stable at the foundation, you're not going to have strength in your wrist if your spine isn't stable, your scapulothoracic joint isn't stable, your glenohumeral joint isn't stable, and then further moving down until you get to the wrist. And we've seen that with research where it's shown that rotator cuff issues will have a weakened grip strength. They're not directly related. It's not, those muscles aren't directly affected or torn or injured, but it does affect how your body generates strength going outwards.
And that's a perfect example of a sling, like a functional sling, right?
Yeah. Yeah.
So that's cool.
Okay. Okay, so we talked a little bit about this before. So you said your fiance, which would have been husband in like less than a month. So you said like you're trying to encourage more movement. So for him, like how are you doing that? How are you finding ways, creative ways to do that, especially with like family and friends? And
yeah, it's rough, man. So Paris is great. He loves to train. He's a movement guy. He can literally pick up a sport and run with it, where I have to know the movement, do the movement, have repetition, and then I'm good. He can literally just pick up anything and do it.
So his brain's like still super like malleable, where it can like just quickly build patterns.
Yeah, and he's phenomenal when he's on. But lately he's been doing a lot of desk work. He works from home. He's skipping meals, so I'm trying to get him to eat properly. But on Saturday, you know, he's been working from 9 a.m. to like, I think it was like 5. And I was finally like, all right, I'm going to go out for a run. Let's go. And he was like, all right, let's go. So then we ran through the trail and we ran through the bike path. We did a couple laps around the football field. And then it was kind of just like, let's take this time to spend together, but also let's train and make each other better. So I've been trying to get a lot of my friends who aren't into fitness or who are trying to get back into fitness to kind of view it the same way. Hey, I want to be a badass. I want to do badass things, but you're not going to be able to do a pull-up or run for more than 20 minutes if you don't train for it, right? Where's that foundation? And trying to make it fun is, I think, so important. You know, just making sure that you have the community, you have encouragement, and you're always doing things to make you better at that movement.
Yeah. Not in terms of particular movements, but I think the community aspect is very key. I think there's too many people who are focused on one type of training and not on others. So I think it's key. I think we talked about this a few days ago, where you need to have a mobility piece. There has to be some sort of yoga or movement or stretching or flexibility part of your routine, included with strength, included with neurological firing, you know, speed work, things like that, ladders. And then at the end of it, you want to make sure like everything kind of comes together. So you might resonate a little bit more with particular types of training, but you want to make sure that you're kind of doing everything at the same time. You can't strictly be doing strength training or strictly be doing yoga and not do any strength training. It's like everything is functional. You still need to do all of it. Otherwise, you're going to lose certain parts of it. Right?
Yeah.
If you do too much strength training, you lose mobility. You do too much mobility, you lose stability in the joints or strength in the joints, and you can't lift or do certain things. So I think it's very key that everyone kind of does a little piece. Now the community aspect is very good. So I have Dr. Amrit, Dr. Gurp, and Jay on my Apple Watch, so we can kind of compete. So I can see when they're slacking off, when they haven't worn their watches, and then kind of talk smack to them.
Yeah.
But I'll add you onto my Apple Watch too, and then that way we can all compete all the time. So you can see like when people finish workouts, what they're doing exactly, and what type of workouts that they're doing, and then you can kind of pick your poison and see what you want to challenge them on.
I completely agree. And if you don't have someone pushing you, you're like, you don't have any accountability. So accountability.
Yeah, I think the goals have to come from within though. Like everyone, like my friends don't train the way that I do, and I push myself, and they're like, you know, everyone wants to compete once you're in the building, but not everyone wants to walk into the building. So it's like, you just have to create your own building. You just have to do it yourself. So for me, it's like, I don't really enjoy strength training, but I do it because it'll help me in sport, in basketball and baseball and volleyball, whatever it is. So that's why I strength train. So I'm not enjoying staring at the wall or staring at the mirror while I'm doing like 10 deadlifts. It's just like 1, 2, like it's kind of lame to me. I'd much rather just play sport, but I'm thinking about how it's going to apply to sport, which is what's kind of helping me kind of move along. Because before I used to get pushed in the paint, bodied all the time, by bigger guys. So it's like by training, I'm stopping that from happening, and I see that once I do train or once I do move.
Yeah.
Yeah. Okay, Gaithan has a question there.
Any basic
yeah, go ahead.
workouts that can help with stability and strength training? So strength training and so stability and strength training kind of have to happen separately before they happen together, right? So we need to create that stability first. So all the boring movements, the not so sexy movements, you know, you're not deadlifting, you're not doing a clean and jerk, or you're not bench pressing. That's, you know, you don't do that for stability. For stability, you do the breathing, you do more mobility, elongating, contracting, those yoga movements. Basically, you're priming.
Making sure that you have full range of motion first.
Exactly.
And it's strong throughout that entire range of motion. Otherwise, if you just strictly bench press, you're only going to be strong in that one particular range of motion.
Right.
But anywhere else. I had a patient, a really good friend, do this actually. So he was he was doing dumbbell, like a dumbbell press. And essentially his shoulder just extremely rotated just a bit, where it was too much, and he had to drop the weight like right then and there. And then his shoulder was just hurting after that. It's probably, and then he told me, he's like, I didn't warm up that day. And I was like,
you didn't prime the movement.
You didn't apply the primer. That's exactly what it was. Yeah.
So you got to put your body through what it's going to go through with load. So put it in a basic movement. Like if you're going to bench press, do some push-ups, body weight. You know, if you're going to do anything shoulder, you want to make sure you have full range of motion, like Dr. Karishma said. So priming that body part and then adding strength to it slowly. Also, don't just put on 200 pounds onto a barbell and go. Like you need to work your way up to that.
Yeah, for sure. And people don't understand that. People don't understand that. And I feel like there's also intimidation. Like don't work out at a gym that makes you feel like that. Like, why do you feel like you got to be like,